On-the-scene coverage of ACC 2015 is supported by Effiant.
I'm Peter Block in San Diego here at ACC 2015 for On the Scene. And with me is Stefan Anker from Berlin. Stefan is a trialist and he has talked about Algicil, crazy drug, something to use for people that have congestive heart failure. Stefan, I'm going to ask you first off what Algicil is and how you get it to the heart.
Algicil is a substance that comes from the sea. You clean it. It's essentially a spongy type substance, and you inject it epicardially, and you make the left ventricular free wall somewhat larger, and thereby improve the physics of the heart pump action.
So it has no contractile properties as such, is that correct?
100% correct.
So this is a volume expander, if you want to think of it that way.
Yes, but in the future it could also be a drug carrier.
Okay, perfect. So this is put in through a mini thoracotomy in patients with congestive heart failure, not through a catheter, so externally in the epicardium. So tell me what the trial is that you've just talked about.
The trial is the Augment-Hf trial, where we investigate the impact of this treatment on exercise capacity, symptoms, and outcomes in patients with heart failure.
And I guess the next question is, what'd you find?
Well, we highly significantly improve peak oxygen consumption is a measure of exercise capacity. We have a very strong improvement of 6-minute walk test distance. The difference between the two treatment groups was 141 meters, very, very strong difference. Symptomatically, the patients do better. And if you go beyond 6 months and really recover from the initial surgical stress, of course, then you also in the long term see a reduction in heart failure hospitalizations, but this is an early finding. We need to confirm this with longer follow-up.
So how long does it take these patients to start to feel better? I mean, you're essentially not doing anything specific except expanding their ventricle. What does it take, a week, 2 weeks, a month?
Well, the cardiac function improves essentially immediately because it's pure physics at work. But the symptom improvement after the hospital recovery, 4 to 6 weeks if you're lucky, but from 3 months you really get the symptomatic improvement. The primary endpoint was at 6 months and highly significant.
So doing this, somebody then gets more benefit than the downsides of the surgery? Is that a fair thing to say?
It's a small downside in some patients. We try to really improve this with a better learning curve, with better procedures, better catheters in the future. And you definitely get a big upside, it looks like.
So what's going forward? What do you think is going to happen? Larger trials, of course, to evaluate this further. But you think this is a keeper?
Well, this is at the moment CE approved in Germany. Some reimbursement discussions will start there. The United States, of course, we need to do an FDA regulatory approval trial, and that is planned to start later this year.
Okay, thank you, Stefan. So for all you out there, I would say keep your eye on Algicil. This sounds like it may be a winner. Funny drug, expands the left ventricular size, but doesn't do very much else. The physics work in your favor, and patients, 141 meters as a delta as to what they could do before versus after is extraordinary. So maybe a real winner. Thank you very much, Stefan, for being here.
Pleasure. Thank you.